Hello, I'm Dr. Musaka from Limi Hospitals.
And I'm Dr. Taiwo, Limi Hospital.
We'll be talking today on preconception care, and I want you guys to listen in because you'll be learning a lot. If you have any questions, you will direct it to our live, and we'll be answering all of your questions. So we'll start by telling you a little about preconception care. It's the care that women are supposed to receive just before they get pregnant. And the point of this care is to provide the basic needs of a woman. So biomedical needs, behavioral and social health care for women and couples just before they get pregnant. Yeah. So what it just means is that we identify the things that any woman could have that could affect her pregnancy outcome. So that means if she has any medical problems, if she has any health style behaviors, these are things that we are supposed to identify just before they get pregnant. And then all the health care that they need during the pregnancy, these can be identified just before the pregnancy, and that way it improves the outcome of each pregnancy. And we know that our mortality rate for pregnant women and also for children are actually on the high side. I'll be into our specialist to talk more about this.
In fact, this is a timely uh, health discussion that we need in Nigeria, especially because of what you have just mentioned. The mortality rate in Nigeria is like 20% of the whole mortality in the whole world, when we contribute just about 2% of the global population. Yes, and we notice that majority of our women pregnancy is just like it does come and then we carry it. That's just not planned. And this topic that we are discussing today, preconception care, actually helps to identify some underlying health risk that a woman may have that may impact negatively on her life and then the child that she's carrying, whether during the pregnancy, during the childbirth, or even after delivery. So it actually helps to optimize the woman's health and the health of the family generally. They equally plan financially too. They plan psychologically too before they get pregnant. You understand? So that they can actually cope with the challenges that come even with pregnancy, because it's a physiological state. Of course, if you ask me what is pregnancy, we define it generally as as a state of a woman having a developing baby in her body. It's not a disease, but it comes with so many physiological changes in the woman that can change the whole behavior, the physical appearance of the woman, the psychology of the woman. You understand? So we all need to be prepared for it and to understand. And now, if not, we now have a woman that has some medical conditions before pregnancy, it can actually impact on her life. It can even threaten her life. And that's why we now have, of course, when we talk of morbidity and mortality, there's this morbidity injuries to the woman, to the woman, because of pregnancy that she has, or mortality, dying because as a result of pregnancy related causes. We don't want it. We need to reduce it. That's why Limi Hospital has come up with this to enlighten our populace to understand that in developed world that we are talking about, that their mortality rate is low, is because they take their health serious. They want to optimize their health before they get pregnant. You understand? There are other things that they are doing. We don't want to talk about that, but we are concentrating on the fact that all our intending mothers need to see physician before they get pregnant, so that we can identify risk, you know health risk, or some social behaviors that can actually have a negative impact, whether in getting pregnant or when they have gotten pregnant, it can affect the outcome of pregnancy. You understand? So that's why we are talking about preconception care today.
Thank you very much, Dr. Taiwo. So, just as he has said, we'll just list out the purpose of our topic today. So, it's to establish the lifestyle behavior to maximize optimum health. So, this includes eating healthy, stopping caffeine if you're planning on taking in, removing smoking, alcohol, and even some that take recreational drugs, we do not advise that if you're trying to get pregnant. Then for identifying and treating the condition, so some people have diabetes, hypertension, even mental disorders, and some sickle cell diseases. There are so many diseases that could impact pregnancy, but it's always good to identify them. So if you come to the hospital more frequently and get checked, we're able to pick up these things. And if there are things that cannot be cured but can be controlled, we will be able to control them just before you get pregnant. This will improve outcome of the pregnancy. So mother and baby is happy, which is actually the point of this topic.
It's equally help them, like you have said, that these people conceive, without some of these risks that can have negative impact on them. And the purpose of it too is for intending mothers and fathers to be psychologically prepared. Pregnancy comes with a lot of demands too. Physical demand on the woman, psychological demand on the woman, and even the family, financial demand too. So that we are prepared. We are not just like, oh, we are enjoying ourselves and pregnancy results from it. Do we abort or we keep? Oh, we want to keep. But are we prepared? Because it can affect our profession. It can affect the finances. So that's the essence of preconception care, so that we have the number of baby that we want and when we want. So it helps us to plan. So these are important things that we need to start considering, and we look at it and we believe that it will improve our family well-being. Very important.
I hope you guys are enjoying our live so far. Don't forget to send in your questions throughout this conversation that we're having. So next up, we're talking about what the benefits of this. We know the purpose now of this part of healthcare that not normally spoken about so often. But why do we do this? It's because we want to have good seeking behavior, health seeking behavior in our country. So most of the time it's even pregnancy that gets some women to the hospital. And it's always good to come just before you want to get pregnant. So we'll be able to identify the risk and then also treat it.
Yes, there are some risk factors are treatable. You understand? Some are modifiable. You understand? Because maybe, like, take for example, people that have genetic disease, there is no way you can actually treat it, but you can modify, you can provide some solution, ways around some of the problems that we already identified. But sincerely speaking, because that's why it becomes important for us to talk about preconception care, and for every woman, every reproductive age woman that is intending to get pregnant to have it, is because in our environment, that high maternal morbidity and mortality that we have identified that is happening, especially in our own country, is very important, and this will help to reduce it. Women are dying from postpartum hemorrhage. They are dying from some medical condition like hypertensive disorder in pregnancy, eclampsia. You understand? Which some people have risk factor for developing this, and if detected earlier, some intervention can be done. I can reduce the chances of them developing it or delaying when it's going to develop. You understand? Some, of course, people are dying from abortion and abortion-related complications. You understand? Of which family plan, of course, like people that are supposed to be on family plan, if they are being on it will prevent them from having unwanted, unplanned pregnancy that can lead to even termination of pregnancy, and they can die or have some complication from it. So it's very important. And then it becomes important too because we have poor health seeking habits in our environment. I'm not sick. That's what everybody talks about. I'm not sick. In fact, some people in some religious centers, they are fond of, I have not gone to the hospital in the last 5 years. Yes, we know. We thank God for that. But the truth about it is that some health conditions will not alert us until they have caused serious damage in our body. And at that time, we can't reverse it. We can only try to manage it and help to prolong the life of whoever that has such thing. So it's very, very important. And also, it's equally important because I've seen, as an obstetrician, majority of people, before they know that they are pregnant, is because they miss their period. It's delayed 2 weeks, 3 weeks, or 4 weeks. they have not seen their period. That's when they get to know. Whereas during those periods, the early part of the pregnancy, that during the early part of pregnancy, that baby is actually developing and is prone to developing some complications, especially congenital anomaly. That's when some people are exposed to some drugs, okay, that can actually affect the developing baby. And eventually baby coming down with some congenital abnormality, whether in the of the central nervous system, the brain, meningosis, myelomeningosis, spinal bifida, what we call generally neural tube defect, you understand, or congenital anomaly of the heart, or sometimes there is what we call tracheoesophageal fistula, in which there is a link between the lung, the food pipe and the windpipe, you understand. So that one is there, all of the heart, you understand, or some even defects on the anterior abdominal wall, we call it gastroschisis, ophalosis, some of these congenital anomalies, of which that is why it is important that we come for preconception care, so that some of these things can actually be identified and we can tell us what we need to do, things we need to avoid, things we need to do. Very important. So is and also because I've seen women coming for antenatal booking at 7 months, at 8 months. They have only come to deliver now.
Yes, they have.
What about if they have been exposed to some things? Some people have been given some antibiotics that might actually affect the growing baby. At the time that we need to do some tests to know whether this baby is at risk of developing congenital anomaly, and we can prepare ahead, even at delivery, what form of thing, it has passed. When we can do anomaly scan, that we can recognize some of these things, has passed. But you might have to wait until delivery, and we don't know what we are going to meet. So the outcome. So that's why it's very important, and equally, optimizing the mother's health is very, very important, because the mother's health determines the health of the child. If a woman that is not fine is likely going to have miscarriage, is likely going to have delayed in conception, what we call infertility. So it's very, very important.
Yeah, thank you very much. So far, so good, right? Hope you guys are enjoying our life. So, the obstetrician specialist has said a lot about why we do this preconception care. Now, some of the things that he has already listed out, but I'll just be listing out a few. He said we prevent unintended pregnancy. If we have good preconception care, people will only have pregnancies that they want and when they want them. He also mentioned to reduce maternal and child mortality, not just mortality, the illnesses that affect women and babies before and during pregnancy. So these are some of the things that he has listed. Some other things are that it prevents babies from mothers from having stillborn. So you get pregnant and before you know it, you're expecting your baby and then come to the hospital like every regular day and then baby is not alive. Or you have the baby and at birth you find out that the baby is not alive. It also prevents the other complication. People have babies earlier than they should. So before baby is 9 months, baby is already out.
What we call preterm delivery.
Yes. And low birth weight as well. Prevents birth defect. He has just listed so many, and this is just how important preconception care is to us. The reason why we should have it as part of our health care every time, not just antenatal care. Preconception care should be a part of our care. He also talked about preventing neonatal infection. One of the things that these neonatal infections is the risk of mother to child transmission from HIV. So some people, is when they come for antenatal that we find out that they are even pregnant in the first place, and some don't come early on. They come when they are like 28 weeks, so that's about 7 months, and the baby may have even been exposed, and the risk of the child having HIV is also very high. This can be prevented if she had come earlier and we've assessed her. We'll find out she has HIV, we place her on some medications. We know that it's going to improve the outcome of the baby. We know that the risk of the baby getting HIV reduces. There's also diabetes. Some people don't know that they have them or they have the risk factors. And when they come for preconception healthcare, which we're encouraging every single one of you to take part in after this live at Limi Hospital, I think that it can help identify problems. So people that are at risk of diabetes because maybe they have a family history or they're on the big side. These are the things that are
or they have had gestational diabetes
in the
mellitus
past.
in the past. So it's very important. Or they have had things like unexplained intrauterine fetal death or congenital anomaly. They have delivered a baby that has congenital anomaly. So it's very important for them to be screened before pregnancy so that we can control the blood sugar. Is very, very important. You understand? You've mentioned a lot of the benefits too. In fact, we cannot overemphasize the benefit of you seeking health care just before you conceive.
So now we're going to talk about the components. So this just means we're listing and explaining each of the things that we do at preconception care. One of it is risk assessment. Risk assessment is a big part of preconception care because it helps us identify problems of each person. So we tailor it to each person. Some people don't know they have some health conditions like my specialist has mentioned. But if you come to the hospital just before you're about to get pregnant, we're going to pick up on all of these things. So if you have HIV, you have diabetes, even hepatitis, any of these.
Chronic hypertension, sickle cell disease, we are talking of people that are even on drugs, you understand? Epilepsy, people that are there on taking alcohol, smoking, substance abuse, you know, those that even if you have had a previous cesarean section before. Take for example, we have cases of people that have had like two or three cesarean section and they are still trying to talk about I want to try and maybe try to deliver vaginally by myself and this. We'll discuss the risk. You will know, and then you can prepare yourself psychologically for what to expect during the pregnancy and delivery. So it's equally very important for us to have this. So we do risk assessment. We are just trying to identify. We ask questions about previous medical conditions, surgical conditions, about their gynecological history, their obstetric history, if there is anything that can affect getting pregnant, if there is anything that can affect a baby that is just developing, if there is anything that can affect even the next pregnancy. So it's very, very important. So if you are just joining us, we are discussing preconception care. We are discussing health care that is given to a woman and her husband just before they get pregnant. It's very important. I mentioned her husband too. Yes, there cannot be a mother without a father. You understand? So it's both father and mother, and we need to understand this and be able to work together as couple in order for us to have a healthy baby, and the mother too is healthy for her to be able to take care of her child and be the mother of her child. You don't want mothers that are giving birth and dying and leaving children as motherless. No, it's part of the problem we have in our society.
Yeah, thank you very much. So the next part of the components of preconception care is counseling and health promotion. It cannot be overemphasized. So we're counseling people. So when you come in for preconception care checkup, after we've done a risk assessment, which when we after asking these questions, we also run some tests for you. We do examination for you. So if you're on the big side in your weight or your weight is really, really low, we find a way to optimize you just before you get pregnant. After all of this, we talk about counseling and health promotion. We need to discuss going forward the things that you need to do to put your health at a better place when you're getting pregnant. So this is we identify the things from the research. For instance, if you take a lot of caffeine, coffee, you need to stop that before you get pregnant. It increase the risk of you and your baby having some heart problems. If you smoke, take recreational drugs, take alcohol, you will need to stop that before getting pregnant. And all of these and more are the things that you get when you come and we give you this counseling. That's why it's so important for you to come to the hospital just before getting pregnant. He mentioned the husband, that's the partner of the woman that is about to conceive, and he'll be trying more light on why it is so important that preconception care is not just for the mother but also for the father and also for the family at large.
You know, uh, there is this psychological aspect of our health, our mental health. and it's one of the issues. As an obstetrician, I used to mention too that women are emotional beings and their emotion needs to be attended to, because majority of them comes they're emotionally deprived, maybe because their partners don't understand what they are going through, that the pregnancy has changed a lot, affected the way they think, the way they do things from their normal usual things. Now the pregnancy is dictating some things that is unusual, and the man is not seeing it that it's just because of changes now that the woman is now carrying, their baby, unborn child. They need to understand what it entails. Some don't understand what to expect in the course of pregnancy. Some don't understand what to expect during delivery. Some don't understand what to expect during the preparing when they are nursing their babies and all those things. We seize the opportunity of the interactions that we have with people that are coming for this preconception care, health seeking behavior before pregnancy. We seek the opportunity to counsel them, enlighten them on what to expect. You understand? Even some, because of delay in conception, imagine couples that are having soft fertility, delay in conception, then because they have been having regular sexual activity, it has not been blessed by God for them to have their baby. Many a time they get discouraged. Then I need to ask question: if you don't have, how do you get pregnant? Yes, there are some other technology like assisted reproductive technique, but we want to give everybody a chance to try. If there is no reason we don't want to just suggest that you go and do IVF and this, yes, we know that people are conceiving through it, but we want them to try. When they understand this, they are able to cope with the demands that comes with it. And also, we also recognize that some couples, they are not living happily together. Intimate partner violence is part of the things that we occasionally see during the antenatal. We want to identify this and counsel the couple for them to understand and be able to work together as husband and wife and be able to enjoy their relationship, to foster the love, encourage their love to grow and for them to take care of each other. Yes, it won't be surprising to hear that some men beat their wives in pregnancy, and as a result, some women losing pregnancy, some women not just losing their babies, even losing their life from it. So it's part of what is contributing to this high mobility and maternal mobility and mortality in our environment, which we want, as Limi Hospital, want to contribute to reduction in this. That's why we are coming online to let people know about it, the need for them to seek for healthcare to be assessed before they get pregnant, so that we can reduce all these things and we can have a seemingly, normal pregnancy period without much health challenges.
Wow. I hope you guys are enjoying the life so far. We've talked about a lot of things. Our focus is preconception care, and if you're just joining us, you should just know that we'll be talking a lot about the things that you need to do before getting pregnant. And so far, so good. I hope you've been enjoying yourself. Don't forget to send in your questions as we'll be talking about the things that we need to do in preconception care. So,
If you are just joining us, it's still preconception care that we are talking about, and it all entails, the kind of biomedical, social, and psychological health services that is being provided to couples, both the wife and the husband, just before they get pregnant.
so we listed a lot of things. We're just listing them out again so that people that are just joining us can also get the benefit of listening to it. So we talked about nutrition, food. So what we eat matters a lot on the outcome of pregnancy. So we need to optimize our diet. So that means balanced diet. We're talking you shouldn't just live on carbs alone. We're talking about carbohydrates, protein. We talk about fruits and veggies, which we don't emphasize, which people don't do so much because obviously there may be some cost challenges, but it is very important to have that as part of our normal routine. Let's not forget vitamins and minerals, which is gotten from these fruits and veggies. We talk about there are some conditions that can be prevented with vaccination. In our clients here, it's mostly tetanus, tetanus that we give to pregnant women. I think that it will be good for us to come to the hospital so that we can have this information. And also,
even including hepatitis B vaccine. People that have not been vaccinated before should check their status, and they can receive hepatitis B vaccine. Within 6 months, they have completed it and they are well protected against it. So it's very, very important. There are some other vaccine preventable conditions that are not so common in our own environment, but in some developed world, influenza vaccine, so is there, rubella vaccine is there, but it's not so common in our environment. So we are not talking about that. We are streamlining ourselves to our environment, what is obtainable. Of course, if you are talking about some people that have genetic conditions that can be passed, take for example sickle cell disease, which is common in our environment. Of course, the epicenter of sickle cell disease is in the West Africa. You understand, of which Nigeria is part of it. Actually, about 22-25% of the populace is carries their sickle cell disease. Yes, they carry sickle cell disease gene. So it's actually very, very important for us to screen. We can just do a genotype, then we'll know if one is hemoglobin SS or hemoglobin AS or hemoglobin AA or hemoglobin LC. You know, there are different type of it. Then we can guide before we say, oh yes we do. Or even if we are saying yes we do, we will know the risk that we are facing, that oh, the offspring that will be bringing, children that will be bringing forth are likely going to have this, and these are the kind of condition, you know, some things that can happen to them. We can be prepared emotionally. Some couples that are having abnormal hemoglobin combination like AS that are giving birth to SS children, by the time the children are falling sick and they are in and out of the hospital every now and then, they know the impact of it. It's then that the law that has bound them together before, it will start getting strained, and it will be as if they don't love each other. But it's just because of the psychological impact of the health condition of their children that is draining their resources. Because of course in the hospital we don't have free healthcare services for most of these conditions. It's still out of pocket that many people pay. By the time the resources is drained, the husband and wife are not 2 months in agreement with love, dangerous, and then they go their separate ways. So we don't want that. Of course, if you are talking of environmental health condition, of course some people are working in some occupation that may expose them to carcinogens, things that can cause congenital abnormalities in the baby. Take for example, a woman that is working in X-ray department where radiation she's constantly exposed to radiation. Of course, those that are working there, they have what they use to measure the exposure to radiation, and then they can give them some time off so that they are not exposed to that kind of radiation. And if they are pregnant, want to exclude them from that, because their baby once exposed. It's the reason why sometimes some baby have some congenital abnormalities or birth defects. It's a reason why some babies even have some childhood cancer. You know, so we want to ensure that they avoid that. Even today, now everybody is going to agree, and we are using various forms of pesticides and the like. We are consuming some, chemicals now. Unlike gone are those days when our grandpas and the like, the kind of manure they put to fertilize their crops and the like. It's more hygienic, unlike now that everything is now chemical. I pray God helps us, from this one. So it's very important. And also the cosmetics that we use, there are some chemical substances that are not compatible, especially for intending mothers, that may affect their babies. It's being absorbed and those things are getting to the baby. It can cause damage. Then we'll be asking questions, how come I have this? How do I have this, doc? And we'll be scratching our brain trying to look for what is not there, but the woman had it there. So it's very important. Of course, part of what preconception care takes care of is infertility, or what we call subfertility, delay in conception. When a couple have delay in achieving pregnancy after regular unprotected sexual intercourse of at least 12-month duration. You understand? Or for those that are like 35 years, especially if the woman is like 35 years and above, we are looking at 6 months. They have been having regular unprotected sexual intercourse, and then there is no pregnancy. We want to address it, we want to look at it. What exactly is responsible for this? How do we manage them? How do we optimize them? Equally, we discuss with couples, the need for them to have a good sexual behaviors. Of course, some people have their husband at home, they are still enjoying somebody else outside. Some people have their wife at home, they are still enjoying somebody else outside, and they are not using protection. Of course, there is what we call dual protection. When you use condom, you use of course, when you use condom, it's a barrier method. It helps to prevent against sexually transmitted infection that can impact negatively on the chances of fertility, of conception of the woman or of the family. So it's very important. So we talked about it. For us, we encourage that, oh, one man, one woman, as is being said. But if we have to do it the other way around, then we should be able to know how to protect ourselves so that we don't end up having some complication that we know it can happen, but we just don't concentrate on them. We don't put them in mind and work towards preventing them. So we can't do that. And it's simple. Just simple thing. Even this preconception care that we're talking about, some people might think that it's just like 1 billion naira that it will take, especially if you come to our center. No, it's just normal thing. We identify some of these things. If you need to do tests, we run the necessary tests to identify the risks that you have, and we discuss. We let you know things you need to do, things you need not to do. If you have health condition that we need to work on, we work on it. So that's very important. Some people have, of course, there is what we call female genital mutilation, which presently we call it female genital cutting. That is an female circumcision, which is being discouraged because this thing affects our women. Some women, their clitoris, which helps in their sexual arousal, you understand, have been cut off just because of some traditional things that we do in families, or in some regions is more peculiar to common in some regions of Nigeria than other ones. But some is family things. And we think about it that maybe because of that thing, if by the time she has it, she'll be promiscuous. No, it doesn't stop a woman from having that. Sometimes we think about it too. Sometimes we think about it too that it's because by the time the woman that doesn't have her clitoris circumcised, by the time she's delivering, that the baby touches it, is going to bring bad luck to the baby. No, please. This thing affects them many a times when they are delivering. Some, it's not just only clitoris. For some, is even the clitoris, the vagina that they have already excised, they have narrowed the place, and by the time they want to deliver vaginally, it becomes difficult for them to deliver. Sometimes is a reason why some people have obstructed labor. It's a reason why some people have very bad pericarditis. You understand? So we don't want this. We discourage this, especially. Please, our newborn mothers, for our newborn female babies, please, we discourage female circumcision. Please, it's only the male circumcision that we encourage. Please, let's not cut off our female, external female genitalia. Please, it's very important. And then sometimes too, of course, some people don't understand that there are ways to prevent too frequent pregnancies. Ideally, the minimum best spacing that has been recommended is at least 2 years. But we see that some people that have cesarean section done, yes, but some people, they may have been working. Sometimes the outcome, they have a negative outcome, maybe they make it. So for those ones, they may not want to wait for long because of some other psychological impact of that on them. But for some, maybe still doing fine. The next 3 months, the madam is looking for her menses. It's been stolen again. But we used to encourage family planning so that we can have child spacing. The woman too can recover from the effect of the pregnancy that she has just had, that have just ended. It's very important for us to have this, so we can discuss family planning. It can help us to optimize our health before the next pregnancy. Even for those that have some medical condition, one of the things that can be done too is to give them protective contraceptive that can help to delay conception. We cannot say husband and wife should not see themselves. That is one of the reasons why we go into marriage. But we don't want pregnancy because when some medical condition like heart failure, we are talking of diabetes, we are talking of hypertension, they are not well controlled, and the woman is getting pregnant with it. It can affect. It's a reason why they can have miscarriage. It's a reason why the woman can even die. It's a reason why some organs in the or system in the body can be damaged too. You understand? So we want them to be on contraceptive while they are being optimized. So it's very, very important. We've talked about sexually transmitted infection, but of course we have made mention of the need why we need to support each other. We need not to, men and women. Yes, when we talk of intimate partner violence. It's not only men beating women. Some women beat their husband too. It's happening both ways. It's just that the proportion differs. But please, we want our husbands to support our wives, our mothers in the house. Please, they need our support. Yes, pregnancy goes with a lot of psychological impact, so it's very, very important.
Hope you guys have enjoyed all the things that we've said so far. We'll soon start entertaining questions. So don't forget to write down all your questions. There's still a lot to talk about. And all this you can get when you come for preconception care. We hope that we've been able to convince you that it is very important part of care that women and couples need to have. We've talked about a lot of things. I hope you've been jotting down, taking notes, having your questions. Just keep them ready because we'll be addressing some of these things. We've talked about genetic problems, we've talked about interpersonal violence, we've talked about quite a lot of things. I know it may look like a bulky thing, but really, if you come and have the care, you will see that it's a very important part of our healthcare and it should be encouraged. So now we're talking about the role of men in preconception care. Specialists have been talking a lot about why men need to participate in preconception care. Preconception care, antenatal care, postpartum, all the care that we need. So he'll be throwing more light on it again.
Of course, when we talked about preconception care, most in Africa, in most of the families, until the man says you can go to the hospital before the woman can go. So when the man knows that no, if madam is fine, she should be able to bring, to deliver a healthy baby too. You want, most times in Nigeria, I looked at the National Demographic Survey of Nigeria. The latest one was in 2018. Of course, it's men that want more children than women. Of course, it's the woman that wears the shoes. She knows where it pinches. So if she has had a turbulent pregnancy period, she wants to go again, she wants to risk her life. You understand? Most women will never want to do that. But men, because we don't pay attention to, their health need. Many a time we just feel like, what is the name? The one woman just gave birth to another one. She gave birth 2 years ago. She don't give birth again. I want to give birth to, no, I need 3 boys and 3 girls. You understand? No, let's consider the health of our mother. Please, I'm begging us in the name of God. Please, let's put the health of our wife, at the forefront too. Even though we want a newborn child, please, their health, they must be in good state of health before they can give birth to another child. So please, let's give them the room, the opportunity to seek health, and not just seeking health services. Please, in appropriate places. Some of us go to some other places to seek. There are some people that I call neighborhood doctors. Sorry, please, I just need to let us know too. There are some people that they are not trained to give us health advices. Those are the people that we are relying on. And many times when we give health advices, some people are just relying on experiences of somebody. That's just a single person. When we talk in terms of health, in statistics, we pull, evidences together and we look at it before we say, okay, this is it. So please, let's go to the appropriate places. Of course, Limi Hospital is a multi-specialist hospital where we have obstetrician, gynecologist, family physician, we have the cardiologist, we have the endocrinologist, we have, different subspecialties of medicine. Name it, you find it there. Come, you will enjoy our service. So please, let's allow our wives, we ourselves too, we need to be in good state of health. Have seen some pregnant women too running after the health of their husband too. In the hospital, the husband is admitted, she's the one going up and down too. We equally need to be in good state of health. Let's carry ourselves together. Go to the hospital, be evaluated, be assessed. So it's very important. I've mentioned before, same sexual practices. I'm not saying that some women are not saying, some other men be, outside of their husband. But please don't ask me. Nobody has told me that. Please. But one thing is that I equally know that some men too, they have some other people too. But please, faithfulness in marriage is what we encourage at Limi Hospital. But Meanwhile, if you know you have somebody else outside that you feel like enjoying too, please, let's use protection. Condom is there. It will help to prevent us from carrying sexually transmitted infection from outside and giving our wives. It's very important, please. So let's do that. Of course, for men too, when we talk of infertility, it's not only about women, and it's so disheartening that in our environment, oh my goodness, people think it's women that have problem when there is delay. Some men don't know that they have issue. We have seen them over and over. You will evaluate some women, there is no abnormality that you can talk of. But what of Oga is not coming? He said he doesn't have problem. This, that, and the likes, and eventually you will evaluate and you discover that, oh, it's Oga that has even low sperm count, or the semen is not even there at all. Yes, sometimes you may say that, okay, we have impregnated somebody before. Who knows whether the woman is just trying to see because of the potential that she sees in us, and she wants us to take another person's child, and that is why you're saying that you are the one that impregnated me and all those things. But that is not a good way of assessing our fertility potential until you have been examined. So it's very important. When we come, we'll be able to examine. However, there are some other behavioral activities that we need to change to ensure that we don't have, we are not exposed to low sperm count. Of course, when there is, God has a reason why He puts our things, where it is. I'm sorry, we are alive. We don't want to be mentioning some things just anyhow, but God has a reason for putting it there. And the major reason is that the testicles need not to be under excessive heat. When it's there, it's going to affect sperm production. So that's why we encourage men, please wear loose pants. You understand? Not a nylon one too that can be building up heat and be affecting sperm production. Of course, there are some even occupations too that may affect, our sperm production. Take for example, a man that drives long distance, he will sit on the same chair and driving over a long distance, heat generation, you can't even change space to allow air to blow, so it can affect. Some people work in an environment that has plenty heat, they generate heat. Take for example, people that work in bakery, they are going to put bread inside oven and it's heated so that it can bake the bread. So that one is there. Even some men works in some like chemical companies, like where they make paints. There are some chemicals there too that may affect sperm production. So we look at all these things. We need to avoid it. Of course, those of us that smoking affects fertility. It affects sperm concentration. It affects even women too. That's why we discourage smoking. Men and women that are intending to get pregnant, we discourage it. Please, let's stop it if you want to get pregnant. So that one is there. Of course, alcohol too. When it's taken in excess too, fine. If as much as possible, one of the things we encourage is to stop it. But if you don't stop, reduce it significantly so that it doesn't affect your fertility potential. Of course, my colleague had already mentioned caffeine. You understand? It has impact on newborn baby that is developing, so it's very important. Of course, for a number of us, because of the nature of our work, some people don't have routine exercise schedule, which helps to keep our whole body system in good state of health. And thank God, at Limi Hospital, every last Saturday of the month, we do Abuja Health Walk. We invite and encourage all our patients to come and join us every last Saturday. We do it just about 2 hours. Yes, we do various form of exercises that is whether you have some medical condition or not. We do things tailored to our health. So it's important. And then we have been talking about the impact of obesity, even on men too. You understand? If one is on the very big side, it can affect our sexual performance. Of course, when we are on the big side too, there are other health challenges that can come up, like hypertension, like diabetes. You understand? That we will have to be on drug for. So we ensure that we reduce our weight. It's very, very important. Of course, we have talked about family planning. We want everybody. Yes, I always say it. All our delivered women, the women that are delivering in our facility, we discuss with them from antenatal the need for them to take up family planning. They have enough time to think about it, to ask questions about it. We address their fears and even some myths that people have about family planning. It helps to space children so that we don't have more than what we can care for. Some people, of course, we understand the situation, the economic situation in the country, but we want pregnancy to be planned. We just don't want an unplanned pregnancy, because those are the ones that exposes the families to some even intimate partner violence and some challenges in taking care of their babies. So it's very important. Of course, we equally need to plan our finances so that we can take care of pregnancy, we can take care of our newborn babies. Some people, they are pregnant, by the time they want to deliver, they don't even have baby materials. They are talking about delivery. Why some people goes to some less qualified health facilities is because maybe they feel they can't afford the healthcare services in some places where they could have been well taken care of, and eventually after they have bastardized them, they will still send them to the appropriate places. So it's very important that we plan our finances too. And of course, family planning, it will help us to have babies when we want to have babies. Of course, for those that are on some medications for chronic medical disorders, you understand, we can actually change some of these drugs to things that can, some men are on some drugs. Take for example some of them that are on some antihypertensive, it can affect their libido, it can affect the erection. You understand, we change the drugs if they have something of this nature. Of course, we equally encourage our husbands to follow their wives down to the hospital for them to be enlightened on physiological changes in pregnancy. Oh, thank God for some husbands that are following their women to antenatal clinic in Limi hospital. Some are wonderful, wonderful, wonderful. I was on the ward this morning, and one of our patients that was on admission, I saw the husband feeding the wife. I was encouraged, I was so happy. It shows that this man takes good care of his wife. This is what we encourage. We want to encourage, we want the husband to understand what their wives are going through, that they need help. They can't do it alone. They need their support. So it's very important. Thank you. If you are just joining us, what we've been discussing for almost an hour now is all about preconception care, the form of specialized care that is tailored towards identifying risk factors, risk assessment of women that are intending to have to get pregnant, so that we can identify their medical conditions, social conditions, or psychological conditions that they have, so that we'll be able to treat or modify those conditions. So please don't forget to send your questions. We just don't want to be talking. I know a number of us at home out there, you have plenty questions you want to ask us. Keep them coming so that we can address your questions. Please, we would like to have that one.
So we'll be attending to the questions now. One of the questions that has been sent in is, how can I improve my chances of getting pregnant if I have irregular cycle?
Obviously, if there is irregular cycle, the person needs to see specialists, not just any doctor. You need to see a gynecologist so that we can assess why are you having irregular cycle. We need to know before we talk about the treatment. We need to assess. Then we now know the form of treatment we are going to give. Of course, in Limi hospital we have gynecologists, of which I'm one of them. So we are accessible. Our clinic opens from Monday to Friday. You always see us at the clinic. Come over, we will discuss with you. We will ask you questions, we will examine you, we will investigate as appropriate and be able to tailor your treatment based on what we have found. So it's very important.
Very important. I hope that has answered your question. Our next question is, does vaginal lubrication for intercourse affect my chance of getting pregnant? Of course it does. It does affect it, depending on the lubricant you're using. So if you're using a lubricant that can kill sperm, so the ones that have spermicides in them, it can affect the outcome. And if you have lubricants that are not water-based, so the one that are oily-based, can also affect fertility, because the sperm will not be able to move through and cause fertilization. So yes, we encourage water-based lubricants that do not have spermicides. Next question.
Of course, before we go to the next one, the question too is that why are we using lubricants? Let it be recommended by a specialist. So we need to understand what is making us to use that lubricant. Is it that we are having dry sex? What exactly is responsible for that? So that needs to be looked into before we go on with what we are using. I know that some over the counters, when you go out there to some places, whether it's pharmacy or chemist shop, they recommend some things. Fine, I'm not saying it's bad, but all the same, what we want is that the best for our patient, that in at Limi hospital we call them guests, because we take care of them. We want to take care of their whole, their whole body, spirit, soul, and body. Yes, not just just to say what's wrong with you. No, we take care of them. We identify with our guests. They become like our family. Yes.
Okay. So the next question is, when is the best time in my menstrual cycle to have sex if I wish to get pregnant?
Of course, the best time to have sex is around the ovulation period. The ovulation period is dependent on each woman's menstrual cycle length. Medically, we will say that the last 14 days of the menstrual cycle is actually constant, meaning that for a woman that has 28 days menstrual cycle, when you remove 14 from 28 days, you have 14 days left. So we expect her to ovulate around day 14 of her menstrual cycle. And if her cycle length is around 30 days, so when we remove 14 from 30, it's going to be 16. So meaning that around day 16 of her cycle, that's when she's likely going to have a ovulation. However, the menstrual cycle length is not constant in the same woman. The important thing about it is that a particular day will be more frequent, and that is what we use. Then we now think about it too, that which one was the shortest cycle length that this woman has, what's the longest cycle length that this woman has too. So we look at it, and it is that period of time that we use to encourage the woman too. You understand that it is around this time, based on your menstrual cycle length, that we have seen, especially if we can have an access to a cycle length over the last 6 months. It can give us an idea of what our cycle length is, and be able to now say, this is when you are likely going to ovulate. That's using menstrual cycle length alone. So around that time, you need to have sex if you want to get pregnant. If you don't want to get pregnant, don't have sex around that time. Or when you have sex, you must use contraceptive.
So far, so good. I hope we've been answering your question. So a question just came in. Does eating groundnut, milk, banana help sperm production?
Yes, these are fruits, nuts, but we are not saying that it's now only groundnut that is the food, or it's only banana that is the food. Yes, that's not what we are saying. What we are saying generally in health, moderation is very important. That is why emphasis is laid on adequate balanced diet. What we call balanced diet is the diet that contains the various classes of food, be it protein, carbohydrate, lipid, fat and oil, mineral, So in the right proportion, not just is only garri and small soup. You understand? No fruits. So that one, it can help us, but it's not that they are just sperm booster as some will think. No, but it will help us to be in good state of health. It will help. That's very important.
One of the questions is, what can men do to support the preconception health of their female partners and their future babies? We've really talked a lot about what men can do.
The role of men, let's be supportive to our wives. Let's be supportive. That child that we so much love is coming from madam. So please, the health of our wives is very important. We need our psychological support, emotional support, we need financial support. Some women, just because they are pregnant, they can't function well, they can't be effective at their places of work. You understand? It affects them. It affects their incomes. So if we are not there for them, it's going to affect them psychologically. It's going to worsen, their emotional states. And that is why some women, I know you, our listener out there, you will have heard of some women, instead of them, you know, smiling and rejoicing that they have given birth safely, sometimes they will just become moody. Sometimes they will start crying. You be wondering what is happening. Why are you crying? What we call maternal blues. Some women have depression, postpartum depression, because majority of them that have that, majority don't have good family support, especially from their husband or the relative around them. So that's why we need to support them, to be very supportive. It is less likely for a woman who has a good support from her husband, a good support from her husband's side, from her home side, to come down with all these psychological disturbances following pregnancy, what we call like maternal blues, maternal depression, postpartum depression, or postpartum psychosis, that may make them to behave as if they are mad.
So thank you so much for answering our questions. We're gradually coming to the end. We just have some more questions. Will my health condition affect my fertility?
Definitely, we have talked about a number of health conditions. Hypertension can affect fertility. Diabetes can affect fertility. Sickle cell disease can affect fertility. Those that have epilepsy, it can affect, or that's what we call seizure disorder. It can affect fertility, especially because of the drug they are taking. People that are on the big side, obese, it can affect fertility. People that are underweight, it can affect fertility. People that are under chronic physical stress, you understand, it can affect their menses, especially for women. It can affect their menses. They may not ovulate, so they won't be able to get pregnant. Of course, those that have had some previous bad obstetric outcome too, we need to look into that so that we can optimize your health before you get pregnant. So it's very important. One thing is certain, please, if you have any medical condition, it is important you see specialists, especially that manages such health condition, of which Limi Hospital is a multi-specialist hospital. There is no, specialist that you want to access that you cannot get. Yes, we will make provision. We are there to resolve all your health challenges. Come visit us and you will never regret.
Yeah. Thank you very much, Dr. Taiwo. We'll just take one last question. So if you have your question, bring it in now. If you have any comments, you can send it to our website and also to our inboxes in our social media platform. I'll be able to answer them. So our final question is, do I need any medical test or vaccine before trying to conceive?
Of course, we need medical tests. We have talked about some. How do I know that a woman has rhesus negative blood? If you don't do blood group, you need to do blood group so that we know. People that have this, they are at risk of having a rhesus immunization, and if they have been sensitized, they have been exposed to a woman that has rhesus negative blood, whether O negative, A negative, or B negative, has been exposed to a baby that has rhesus positive blood, or she has been given blood that has rhesus positive blood, she can become sensitized and it will affect the chances of conception. So it's very important to do test. A woman that has a hemoglobinopathy, that's sickle cell disease, if you don't do genotype, hemoglobin genotype, you won't know, and it will be difficult to manage such individual. They might have started having complication before you realize that you do. So that's very important. Of course, we seize the opportunity to do HIV test for all our pregnant women after counseling, and voluntary testing. So it's very important. Then we screen for hepatitis, we screen for syphilis. All these things can actually affect fertility. Some might delay conception, some they don't delay, but the risk of transmission from the mother to the baby, we don't want our baby to have all this health condition. You understand? So we need to get screened so that we can actually, prevent mother to child and equally manage the woman appropriately. So it's very important. Let me add this to what we have been saying since all this while too. Some women, they've been asking questions, vitamin supplement or food supplement before pregnancy. Yes, very important. In fact, one of the important supplement that we encourage all our intending mothers to take is what we call folic acid, which is very important. We need them to have started taking folic acid at least a month to 3 months before pregnancy. And there are some group of women that it is very important for them to take. Take for example a woman that has diabetes, she's at risk of having congenital anomaly, so she needs to take. A woman that has sickle cell disorder, you understand, it's very important for her to be on it. A woman that is on anti-epilepsy, it's very important for her to be on it, you understand. So but it cuts across all women that are intending to get pregnant. However, we just don't want you to just go out there to start taking drugs. Please visit us at Limi Hospital. We are there, we are waiting for you to see you, assess you, join you too, to ensure that at least we optimize your health prior to pregnancy. And when you are pregnant, we want to attend to you to ensure that you have a stress-free pregnancy period, a disease-free pregnancy period, and that of course the goal of every intending mother is that I want to have a healthy baby. My baby is cute, is handsome, she's beautiful. We want to be a part of your success story. Please visit us. We'll be there and we'll serve you and you will enjoy our services. Thank you for joining us today. If you have more questions, we would like you to send your questions to us.
Don't forget to join us again for another insightful discussion. I am Dr. Michelle Musaka, and
I am Dr. Taiwo William, a consultant obstetrician and gynecologist at Limi Hospital, Central Business District.
thank you so much for joining us. Bye.
Bye. Thank you.